Hi dancers, this is Dr. Rob from Dance Rehab, and thanks for tuning in to this episode of Dance Rehab Dialogues. So one thing that we understand is that it can be intimidating to go see a healthcare professional. You know, you've been dancing, you've had an injury, and all of a sudden it's like, I don't know what to do. What do I expect? Like, who do I go see? What kind of questions do I ask? So here's a little video for you to think about what things to do and what things to think about before your visit, during your visit, and also after your visit. I also want to give a quick shout out to Dr. Koutures of Active Kid MD, who allowed us to be part of this collaboration to create this resource for our dancers and our dancers' families. So before your visit, a few things to think about. First is be dressed to move. I know it sounds very basic, but you'd be surprised at how often sometimes people show up in jeans. Now, we're doing physical therapy, but even if you go see your primary care or your medical doctor, you still want to be dressed to move, because sometimes that gives us more information than you just telling us. So definitely be dressed to move. One, and two, you might want to bring any shoes that you have to wear. So for our ballet dancers particularly, point shoes for sure, bring that with you. If you're doing tap or even your jazz shoes, bring that with you, because that's important to know how that feels and know how you're connecting to the ground in your footwear. So the second thing here is have a list of your goals, not your parents, not your teacher, not your other friends. Your goals, specifically the things that you want to do and what you want to get back to, so both short-term and long-term. And I think this is important because we want to be able to recognize what things you are looking to get back to. Now, there's a lot of other different types of stressors that we can think about. There's, my team's goals because we have to perform. There's, I have to go to class because my parents are paying for class, or my teacher wants me to do X, Y, and Z, which is all very valid, but at the same time, we need to recognize that you have your own goals too, and how can we get there with you specifically in mind. The third thing is don't be afraid to bring videos or share videos. And I know sometimes it can get a little awkward because you're like, oh, that wasn't a good performance, or that wasn't my best one, or like I messed up here. That's totally fine. In fact, we want to be able to see those things so we can know what to work on specifically for you. It's very different to be in the clinic or to be working with someone in physical therapy, and we'll do our tests and things like that, but ultimately being able to see you on stage in your element in that environment is an entirely different assessment, if you will. Watching the way you perform is also important because that's a different side of you that we might not be able to see directly in the clinic, but this is going to give us a much better idea of where you're at. Now, we of course don't hope that you capture these moments of injury on video, but if that happens, that's even better because now we can get a very clear picture of how something happened, when something happened, what you were wearing, what the environment was like, and that's just going to give us a ton more information as well. So don't be afraid to share videos. Now, during your visit is when, of course, things ebb and flow, but some things to think about. Number one, for during your visit is be a student of your own body. So when we think of injury and pain and discomfort, it's really our body trying to tell us something. It's telling us to pay attention. So think about, how am I going to learn about the things that my body is telling me? Now, there of course might be different things we feel, but that's where we come in and help. We can say, hey, this is more of an aching discomfort. This is more of a sharp pain discomfort. What do those things mean? And what do those things mean specifically for you? And how can we learn about what things our body feels and how can we respond to that appropriately, right? Is it more about movement? Can I move in a certain way that makes me feel less aggravated? Or do I need to move in a certain way to allow for healing to happen? So be a student of your own body. Secondly, be genuine and ask real questions. Ask genuine questions about yourself. I think sometimes we go into meeting a doctor or meeting a physical therapist or any other healthcare professional and we feel like, oh, I'm in this space and I feel like they're just going to tell me what to do and I just need to follow those rules and those instructions. But really, for us, rehab or any kind of training, it's a dialogue. So it's really about learning about what you are thinking and what you are feeling and what things work for you. I might give you 3 or 4 exercises, and those might be 3 or 4 exercises that are really great, but are those 3 or 4 exercises absolutely right for you? So being able to express yourself and saying, oh, I'm not really feeling it here, or I don't know if this is really working out, or I might be feeling more discomfort. Don't be afraid to communicate those things. Ask genuine questions and express yourself freely, because the more honest you are with yourself and the more honest you are with us, the better that we can address your concerns, one, and then two, the better that we can approach your rehab or your training the way that you need it and the way you feel like you need it as well. So one of the more important things in rehab and seeing a physical therapist or a medical professional is asking, what are the things that I can do? I think it's really easy to think about our injuries and say, well, I can't do this and I can't do that, or this hurts, so I'm not going to do it. But I think when we have our conversations during your evaluations or during your follow-ups, it's really looking at what are the things you can do, and ask that of your physical therapists or of your medical doctors to say, what can I do? How can I be proactive in getting back to where I need to be? It's not just about you can't dance for 6 weeks and then go back full force. What does that look like to slowly grade it up? What does it look like to modify certain things so you can still continue training the things that you can train while also respecting the body's healing process? So for after your visit, one of the most important things is going to be building your team. And what does this mean? Building your team means finding people that you know will support you in all the ways that you need. So in the physical realm, obviously, if we're dealing with a physical injury, then your physical therapist or your athletic trainer or your chiropractor will be part of your team, your go-to person to ask questions, to figure out whether or not something is appropriate or if you have to modify. Part of your team is also friends and family. We understand that mental and emotional stresses are hard, especially if you've been dancing a lot and all of a sudden that comes down a little bit. What's your support system like? Do you have people to cheer you on and make sure to keep you accountable on things like your exercises, perhaps? Or perhaps it's even just keeping your mind in a good place, right? And that we don't just focus on the fact that we're not dancing, but we're focusing on the things that we can be doing. So find your cheerleading squad. The other part of this might also be with your teachers, thinking about how can my teachers support me? How do I build my team? So if your teacher has a resource that they might have to go to, then you can find them and then they can direct you in that direction as well. So it's not always having a one go-to person, but it's having a network of people that you know that have your best interests in mind, that can keep your training and your rehab in the center of their intentions. So then you are the main focus, and so we can get you back to where you need to be. So in conclusion, I know dance injuries are really hard to navigate, depending on who you are, depending on what you're doing. Sometimes it's a bump in the road, sometimes it's a few bumps in a road, sometimes it does have to be a complete stop. But I think ultimately, the more better prepared you are to go talk to your healthcare providers, or continuing to talk to your healthcare providers, that's going to give you a better sense of what you can do. It's going to give you a better sense of direction, and it's going to give you a better sense of a plan in terms of reaching your goals in both rehab and in training. So hopefully you feel a little bit more prepared with these tips. The biggest thing for us is rehab and training is a learning process. And in order to learn the best that we can, we have to ask the right questions. So before your visit, during your visit, after your visit, make sure you're asking yourself these questions that we just went through, and can you check off these boxes and say, yes, I have a list of my goals. Yes, I am prepared to learn about what my body is telling me during my visits, and then yes, I've built my team, I have my resources. So as far as dance goes, we prepare ourselves to dance, but at the same time, we also need to prepare to take care of ourselves as people and make sure we have the right resources. So happy dancing and good vibes to you all.